Hello everyone. I'm Dr. Manoj Dongare, a surgical oncologist at Cloverleaf Cancer Clinic, Wakad. Many times patients come to me with a diagnosis of breast cancer. They've been seen by a surgeon who's been advising them to get surgery first, to do the whole mastectomy first, and they also take a second opinion from a medical oncologist who suggests to take chemotherapy first. So they are always in a bit of confusion whether to go ahead for surgery or chemotherapy. See, both of these treatment options have their own purposes. Surgery mainly removes the tumor and you sample the axillary lymph nodes to get an exact staging of the tumor. And the chemotherapy is done so that you destroy the cells which are in the bloodstream that are traveling to the liver, lungs, brain, and other organs. Each of them have their own purposes. They both complement each other, and no treatment is complete without each other. So how do you decide? So it usually depends on the stage of the tumor, whether it's at the first stage, whether it's the second or third stage, or whether the patient wants to save the breast or she wants to completely remove the breast. I would like to discuss a few scenarios which would probably give you an idea of what it would sound, what would be a better option. For example, if a patient comes with a small tumor which is in the first or second stage and does not spread anywhere, there are two options in this. One is if the patient wants a mastectomy or removal of the whole breast, then I would suggest to go ahead with removal of the breast and the axillary lymph nodes and then go ahead with chemotherapy. However, if the patient wants probably breast conservation surgery where she wants to preserve the breast, I would suggest that you go ahead with chemotherapy first, take 3 to 4 cycles of chemotherapy, downshrink the tumor so that the area that you have removed is smaller and the cosmetic result would be better. If the tumor is slightly advanced in size, the chances of tumor cells being in the bloodstream are quite higher. So it would be better to target these cells first before going for surgery. So in these cases, we advise them to complete 4 cycles of chemotherapy first and then go ahead with surgery and then complete the rest of the schedule. They might require radiotherapy also in most of these cases. Some tumors which are hormone insensitive, which we call as triple negative, which is ER/PR and HER2 negative tumors, it is always better to complete chemotherapy first and then go ahead with surgery. I hope this answers some of this, most of your questions. And if you have any doubts, you can contact us at Cloverleaf Cancer Clinic, and we will be able to sort it out. Sorry. Thank you.